Good morning, everyone. My name is Dominique Becknow, and I work with Gamble Communications. It is our pleasure to work with the team at the Louisiana Policy Institute. I want to thank you for joining us today for our virtual press conference. It's my pleasure to now introduce Dr. Libby Saunier, who's the Executive Director at the Louisiana Policy Institute for Children. Take it away, Libby.
Thank you, Dominique. Good morning, and thank you all for joining us today. My name is Dr. Libby Saunier, and I'm the Executive Director of the Louisiana Policy Institute for Children. As an independent source of data, research, and pertinent information for policymakers, the Louisiana Policy Institute for Children works to shed light on the state of early care and education in Louisiana. Alongside our partners, the Policy Institute has been conducting a series of surveys on the impact of COVID-19 pandemic on childcare in Louisiana. These surveys have provided real-time insights into the state of early care and education over the course of the pandemic, including the evolving challenges and circumstances facing childcare providers. The report details the findings of the fourth survey of the childcare providers, conducted January 13th through 27th, 2021, while Louisiana remained in phase 2 of reopening. I cannot stress enough that these results show how childcare providers in Louisiana are continuing to face cascading challenges resulting from the COVID-19 pandemic. Before I introduce our moderator for today's press conference, I want to take a moment to thank our partners, without whom our work would not be possible. Agenda for Children, the Child Care Association of Louisiana, Child Care Connections for Northeast Louisiana, the Louisiana Association of United Ways, Northwestern State University, On Track by 5 Alliance, Point Coupee Early Childhood Coalition, the United Way of Southeast Louisiana, and Volunteers of America. At this time, it's my great honor to introduce today's moderator, Senator Beth Mizell. Senator Mizell is the state senator for District 12 and serves as the president pro tem of the Senate. As a mother, grandmother, a businesswoman, and a cattle rancher, Senator Mizell serves on the State Senate Committee of Education and is co-chair of the Early Childhood Care and Education Commission, the Louisiana Commission on Civic Education, and is an Early Learning Fellow. Thank you, Senator Mizell, for leading today's program. We're going to keep moving while Senator Mizell works on her technical difficulties. So today's virtual press conference will share the finding of the Policy Institute latest results, New Year, same challenges, the continued impacts of COVID-19 on the Louisiana child care providers. Throughout today's program, we invite you to type questions into the chat box. At the end of the program, there will be a question and answer session when we will attempt to answer and address all inquiries. It is my pleasure to now welcome our first panelist, Louisiana State Representative Amy Adado Freeman, who represents District 98 in Orleans Parish. Welcome, Representative Freeman.
Thank you for the introduction, Libby, and I hope that Senator Mizell gets her technology back, because this is just the world we live in. So I know that's frustrating, because I was actually on a Zoom this morning with her. So I know it worked this morning when she was on the first call we were both on. But I'm pleased to be here, but it's not for a good reason. This report has come up with some critical findings, and unfortunately, the financial outlook for child care providers in Louisiana really remains very bleak, as financial losses have continued to grow. So before the pandemic, child care centers were already operating on razor-thin financial margins. And now, as of January 27, 3/4 of the providers who responded to this survey are nearly at $200,000 per center as far as their losses. And that's the average loss. So there was some more, some less. But this translated itself to an estimated $245 million in collective losses statewide. And this is really disturbing to many of us. The financial losses experienced, even some providers had to permanently close their doors. So over half the providers had to actually borrow funds to pay for business expenses and loaned amounts, and that averaged about $150,000 per center. So this is also very concerning. So 2/3 of the respondents reported having families who were behind on tuition payments. The average center was owed over $16,000. And of course, with so much unemployment, lost jobs, economic hardships, it's not surprising that families would have trouble paying tuition. Childcare providers have been sustaining these losses, and they simply can't afford to raise tuition right now based on what parents are already, in positions where they're experiencing difficulties. So these collective financial losses have really created across the sector an extreme concern for the longevity of many of the childcare centers that are caring for our children in the state of Louisiana. And it's just very important that we have affordable childcare for these families. So while the research that I'm presenting is not good news, I must say that I do hope that these findings will lead to us finding some financial solutions that are real for these families and for the children of Louisiana.
Absolutely. Thank you so much, Representative Freeman. Next, I'm pleased to introduce Taylor Dunn, Deputy Assistant Superintendent of Early Childhood Strategy at the Louisiana Department of Education. Taylor will be sharing the second key takeaway from the Policy Institute survey.
Thank you, Libby, and thank you to the team at the Policy Institute for inviting me to participate in today's virtual event, and frankly, for conducting these surveys over the course of the last year. I echo what Representative Freeman said. I'm really excited to be here and share these results with you, and really hopeful that the upsetting results that come from these surveys will help shine light on the fragility of the childcare sector, what has always been true and what is even more true now in the wake of COVID-19. So thank you to the representatives and senators on the line, as well as the staff at the Policy Institute for your work. So the Policy Institute's most recent report shows that the temporary closures of early care and education centers resulting from potential or confirmed COVID-19 cases further exacerbated the financial challenges of remaining open to serve families. Nearly half of providers responding to the survey had a child or staff member with a potential or confirmed case of COVID-19 between the months of June 2020 and January 2021. Over 55% of providers had to temporarily close a classroom or their entire center because of a potential or confirmed case of COVID-19 over the course of the pandemic. And during these closures, 77% of impacted providers did not charge families affected by the temporary closure. Only 1/4 of providers did not continue to pay staff in any way during the closures, while 47% of providers continued to pay staff their regular wages throughout the closure. Temporary closures are an additional setback to childcare providers' struggles with the COVID-19 pandemic. Temporary closures, which we know are necessary in the event of a potential or confirmed case, impact families, children, staff, and the childcare businesses. And these closures will continue to slow the full recovery of the childcare sector.
Thank you, Taylor. I think we can hear Senator Mizell now, so I'm going to try to kick it back to her. Okay, I think we're still having technical difficulties, so we will keep going. Again, thanks, Taylor. We really appreciate you and the Louisiana Department of Education through this work. And really thank you all and your team for the incredible work you've done during the COVID-19 pandemic to really meet the needs of childcare in our state. Next, it's my pleasure to introduce you to Louisiana State Representative Christopher Turner, who represents District 12 in Lincoln and Union parishes. Thank you for joining us, Representative. You're on mute. Just a moment.
How about that?
There we go. Perfect.
Is that better? I'm sorry. Hello, everybody. Hey, today I have the opportunity to share another key finding from New Year's Same Challenges, the continued impacts of COVID on Louisiana child care providers. Louisiana child care providers have continued to experience operational challenges throughout the pandemic, further impacting their financial stability and complicating their long-term ability to serve families in their communities. Most providers experienced increased costs from cleaning supplies and difficulty obtaining needed supplies, including personal protective equipment between June 2020 and January 2021. Many providers reported staffing challenges related to the pandemic, including 59% experienced employee absences and 45% facing increased staffing costs. Almost 3/4 of the providers received COVID-19 related grants from the Louisiana Department of Education, and most used those grant funds for typical operating costs, including cleaning supplies, employee wages, utilities, and personal protective equipment. In order to ensure that the centers are safe environments for the staff and the children, child care centers continue to incur additional costs for increased cleaning and sanitation, rehiring and screening staff, and operational expenses on top of the financial losses and temporary closures.
Thank you so much, Representative Turner. I'm pleased now to introduce to you the Louisiana State Representative Polly Thomas to deliver the next key takeaway from this critical survey. Representative Thomas is the representative for District 80 in Jefferson Parish.
Good morning. Thank you for including me in today's virtual press conference. It's a pleasure to see you all. Unfortunately, the latest survey results show that enrollment rates, which are the main driver of child care provider revenue, continue to remain below pre-pandemic levels. Almost 3/4 of providers reported serving fewer children in January 2021 than they did in January 2020 before the pandemic. On average, enrollment was 22% lower in January 2021 than it was in January 2020. Child care enrollment rates are closely connected to staffing needs. Between March 2020 and December 2020, providers reported laying off over 2,200 employees between March 2020 and December 2020. While providers indicated that their businesses were able to rehire 79% of those laid off, providers still employed 710 fewer employees, including teachers and support staff, in January 2021 compared to January 2020. Child care requires well-trained educators to care for children, support positive interpersonal interactions, and foster a safe and secure learning environment. Without staff, child care centers cannot function, but with decreased enrollment rates, child care providers are still making difficult decisions, such as staff layoffs, to keep their businesses afloat.
Thank you so much, Representative Thomas. And I would be remiss not to mention this point for Senator Beth Mizell. This is why we need broadband in our state, particularly in rural areas, to make sure people have access to programs like this and to other things that we have in our state. So thank you again, Representative Thomas, and thank you to Senator Beth Mizell for being so patient as we had technical difficulties today. I'd like to next share the last key findings from our survey in January 2021 related to the child care providers. What we know is that combined, all the factors shared by my colleagues leave Louisiana child care providers uncertain of their ability to remain open in the long term. Less than 40% of providers responding to the survey reported that they could afford to operate in the long term based on their current finances and enrollment rates. By contrast, 38% were unsure of how long their businesses could afford to operate, and another 17% predicted their businesses could only last 6 months or less. Over 60% of providers reported needing additional grant funding or loans to remain open for another 6 months, and another 29% were unsure if they would need additional financial support. The supports available to early care and education providers throughout the pandemic certainly postponed more drastic consequences for their centers and families. But these resources were not enough to offset increased cost or fully protect against the enrollment, staffing, and purchasing challenges faced by providers. Childcare providers indicated funds would be used for basic programming, including employee wages, cleaning supplies, and utilities. Past analysis show that childcare breakdown costs Louisiana businesses $800 million per year and the state economy $1.3 billion a year. We know that a significant number of people in our workforce have young children and therefore need access to reliable, quality childcare in order to go back to work. And finally, we also know that the childcare sector allows all other industries to run and is essential for economic recovery. Working parents still urgently need reliable, affordable childcare, and it is critical that the childcare sector be able to fully rebound to serve families. Before we turn to a question and answer segment, I'd like to thank you and all the presenters, stakeholders, board members, media members, and members of the Policy Institute team, as well as partners for participating in today's critically important conversation today. As we reflect on today's findings, I would be remiss not to recommend the action items that remain necessary to restore early care and education to the level necessary to support Louisiana's full recovery from the COVID-19 pandemic. First, we must maintain use of federal funds to stabilize childcare providers. This includes the issuances of grants and purchasing of cleaning supplies and personal protective equipment, and also offering a wage enhancement to childcare workers, most of whom make less than $10 an hour, or on average, $20,000 a year. Next, we must advocate for the allocation of state revenues from sports betting, both in person and online, to the Early Childhood Education Fund. While proceeds from the sports betting are not expected until 2 years after legalization, the resulting revenue will begin to support the fund at roughly the same time federal aid is set to expire, creating a long-term, sustainable source of funding to expand access to early care and education for working families. Lastly, it's critical that we continue to find ways to expand access to the Child Care Assistance Program, base provider payments on enrollment, and increase outreach to families to young children who are eligible for CCAP. At this time, we're going to proceed with the question and answer portion of the event. Again, thank you all for your participation, and we really hope that you have some thoughtful questions. Well, seeing no questions, again, thank you all for participating in our virtual event today and being patient with us as we navigated through technical difficulties, as we often do these days. If you have any additional questions that we were not able to address today, or you just didn't think of them yet, please email us at info@policyinstitutela.org. To read the full report and learn more about the work that we do at the Louisiana Policy Institute for Children, you can visit our website at www.policyinstitutela.org. Again, we couldn't do this work without your support and your help, and we thank you every day for what you do for children, and particularly for our elected officials for continuing to fight and advocate for the young children of our state. Thank you.